a minute. All right, let's do one quick sound check, and then we'll see our title screen and be able to begin our live stream on TBW this afternoon. But first, a quick sound check. Dr. Shah, can we hear you?
Yes, can you hear me?
Yes, it's a little bit faint. If you can turn it up a little bit.
How's that? Is that better? Is that
I
better?
think that'll work. I think that'll work. Thank you. All right, we'll get started in about 5 seconds here. Good afternoon, and welcome to the Wednesday, February 10th COVID-19 Response Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel for today from the Washington State Department of Health. We have Dr. Umair A. Shah, Secretary of Health, Michelle Roberts, Acting Assistant Secretary, Lacey Fehrenbach, Deputy Secretary for the COVID-19 Response, Paj Nandi, Director of Community Relations and Equity, and Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases. To begin today's briefing, we'll open with remarks from Secretary Shah.
Frangie, thank you. I am not able to start my video. Saying the host has to open.
Oh, hold on for just a moment. Bear with us just one moment. And try now, Dr. Shah.
It is not letting me show the camera, but I can still do, let me at least start my remarks, and then I can come back with the video afterwards if that's okay.
All right, and we'll continue to work on that issue on our end as well. Thank you, Dr. Shah.
Great, no worries. Well, good afternoon. Thank you for joining us. As Frangie just mentioned, my name is Umair Shah, and I'm the Health Secretary for the Department of Health in the state of Washington. And I just want to thank all of you for joining us this afternoon. I have gotten back to the western side of Washington. I'll say that this week I've been visiting eastern Washington and really have had the opportunity to meet with local health jurisdictions, partners on the ground, community leaders, and all sorts of other folks that are just leading the efforts on the ground with COVID-19. There's just an incredible amount of great work that's happening throughout the state of Washington, both with respect to COVID-19 response and in public health broadly. And I wanted to make sure that I visited Eastern Washington and various communities across Eastern Washington because I did want to recognize the work that happens across the entirety of the state, and also to remind everybody that when I first came into this position, I had made the comment that I was not the Secretary of Health of just one part of Washington, but for all of Washington. And so that was really one of the key reasons why I went to various communities across this great state of ours. I did also have the chance to tour the state mass vaccination sites in Spokane and Kennewick. Each of these sites are making a big impact already in just over a couple of weeks of operation. As of Tuesday, for example, our Spokane site has administered more than 7,300 doses of vaccine, and the Kennewick site has administered more than 7,800. I was one of the vaccinators for at least one person on the ground, and I do want to say that the work that is being done on the ground with our private partners, our public partners, our Guard, with the National Guard, we've had just an incredible amount of just work that's being done on the ground. And I also want to just recognize the Department of Health folks who are just working so hard every day. It is so encouraging to see these vaccination sites getting shots into the arms of people, not just at these large throughput sites, but also in community clinics and in pharmacies and other places throughout our system. We could not do it without all of our partners. These efforts are absolutely reflecting the progress we continue to see in our statewide vaccination data. And as you have been continuing to watch, we have set our goal of giving 45,000 vaccinations per day. Our current 7-day average is almost 27,000 doses given each day, and we're continuing to see improvement. But at the same time, we have built the capacity, and this is with the support of Governor Inslee and his team, so that we can give markedly more vaccines if we had the vaccine supply. As you know, this past week, we had requests for 358,000 first dose vaccines across the state, and we only received approximately 110,000 vaccines from our federal partners. Very soon, our providers in the state will have administered 1 million doses of vaccine. This is such an exciting milestone. I'm also so thankful again to all of our partners on the ground, including in the various healthcare systems who are working so closely with all of us to make sure that we can continue to vaccinate as quickly as possible. I also want to recognize our VAC Center, the Vaccine Action Command and Control System Center, VACCS. This is the public-private partnership that we have put together, led by Dan Laster, who have really brought together the real energy of the private sector and coming together to really support state efforts in vaccination. And I just want to say thank you to all of our private partners. More information and details on this effort are going to be coming very soon, probably next week, as we continue to talk through all the different activities that the VAC Center is really working on right now with various work streams. While we celebrate the successes we've had so far, we also recognize there's a lot of work still needed to reach our goals of vaccinating people in our state as quickly as possible. But we also know we want to do this in an equitable manner. And so later today, we are releasing a report on our analysis of vaccination data by race and ethnicity, as well as age. These data are absolutely critical to understand how we need to adjust our vaccine distribution to address health inequities and related access barriers throughout the state. Unfortunately, though, we have prioritized high risk and those populations more at risk or more vulnerable in our vaccine allocation. The report will show that we have significant work to do. And in fact, we have inequities in vaccinations for our Hispanic populations, our Black populations, and multi-racial populations in the state of Washington. Here are some of the findings included in that report. 4.7% of people who have received at least one dose of vaccine and 5.9% of people who are fully vaccinated are Hispanic. That's lower than the Hispanic representation in the state population, which is 13.2%. Black and multiracial people are also underrepresented among vaccinated people compared to the overall state population. This is true both amongst people who have received at least one dose of vaccine and people who are fully vaccinated. Again, the data show us that we need an even more intentional pro-equity approach. And just last week, as you all know, we announced that we had launched the Vaccine Implementation Collaboratives across the state of Washington. And this is really an opportunity for us to get feedback and have dialogue with community stakeholders with the lens of equity as central theme for the work that we're doing. In addition to the data report, we're also releasing a plan later this week for equitable COVID-19 vaccine access with strategies to reduce the inequities we are seeing. Some of those strategies are already underway and others are newly identified. You're going to hear more about the report and our plan as we release this information. I have Paj Nandi, Department of Health's Director of Community Relations and Equity, on this call as well, and he can answer some additional questions. We know that this equity challenge is one that is not just for the state of Washington, it's across the country. And I will say that we are absolutely committed to, as I mentioned earlier with the VAC Center, to increasing throughput and numbers and quantity and effectiveness of our vaccine efforts. Again, with the help of our private sector, while we also focus on and remain focused on our equity concerns that are also a part of the work that we are doing. We're committed to taking immediate action to improve our vaccine distribution efforts from an equity perspective and ensuring equitable and culturally responsive access, particularly for communities that have been disproportionately impacted by COVID-19 in the state of Washington. And we will continue to make this a top priority moving forward. I want to just pause for a moment and say that some across the country have said that if you try to increase the numbers, you lose the ability to address equity. I would challenge all of us to see both of these efforts as complementary and not necessarily at tension with each other. I think it's not an either or, it is an and. So let me move to our vaccine efforts that are on the ground. And I want to again thank all of our partners on the ground who are doing this crucial work of helping people get vaccinated. Again, I was able to see this in some of the tribal clinics. I've been able to see this in the community health centers, local health departments, and certainly our private sector, including in our hospitals. Everyone is on the front line, and you know, the folks that are doing this work on the front line in communities certainly are hearing from community members firsthand. And so we have, as you all know, phases and prioritization plans that we have provided to everyone. They are there to help providers answer the questions about who, when, and why. Our priority as a state is to get to the highest risk populations first. And as you know, that we started off with healthcare workers and first responders and continuing work with long-term care facilities. We're also now in the older population above the age of 65 or multi-generational households above the age of 50. If counties make it through their allocated doses early, and that means in the current phase of 1B1, we certainly want them to contact us at Department of Health, and we will work with them to reallocate those doses across the state. We want to get people in phase 1B1 vaccinated faster and as quickly as possible throughout the state of Washington. We do not want to have counties moving to the next phases earlier than others. We still have a lot of work to do statewide to get to our higher risk populations as fast as we can before we move into other tiers of phase 1B. But there is so much demand that remains, as all of you know, in phase 1B1 still. We needed to catch everyone up before we have what we call early movers ready to advance to the next phase in counties out of alignment with the rest of the state. So we are very much focusing on this, and this is something that we have been communicating with our providers on the ground, and we are going to continue to reiterate the point that we are all in this together. In addition to these vaccine updates, I would like to briefly mention some overall statewide trends. As of yesterday, our state has seen 307,867 confirmed cases of COVID-19. And unfortunately, we've also seen 4,558 deaths. Although we have recently been seeing some hopeful signs like declining transmission, our case counts and hospital admissions continue to be high. We must all continue to take precautions to slow the spread. And I'm hopeful that everybody this past weekend did everything they could to take preventive precautions with Super Bowl activities. However, if you, and this is to our community members, if you gathered with people outside your household for the Super Bowl this past weekend, we want you to keep an eye out for symptoms. If you think you might be getting sick, if you might have symptoms, we want you absolutely to stay home. And if you do notice symptoms, we want you absolutely to get tested. Again, the line is do not guess, don't guess, take the test. And of course, we should all keep up all of our efforts to practice the 3 W's of wearing a mask and washing our hands and watching our distance, but it's complementary to testing, and it's also complementary to our efforts in vaccination. I know there's a lot more that I can say, but I want to pause there, and I will now turn it back over to Frangie and to my colleagues who are going to talk about additional vaccination efforts, but also we are ready to have further conversations and dialogue related to equity concerns with vaccination and other efforts in our state. Frangie, thank you so much. And while I transition back to you, I'm going to quickly pause also to make sure that I can get my camera to be working. Thank you.
Thank you, everybody's apologies. I had a momentary technical difficulty there. Thank you, Dr. Shaw, for your remarks. Next, we'll go to Michelle Roberts.
Great. Thank you, Secretary Shaw. And I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. I want to begin by updating you on the increasing vaccination numbers in our state. As of February 6th, more than 940,000 doses of the COVID-19 vaccine have been given out in Washington. Across the state, we've administered nearly 80% of the more than 1 million doses delivered to our providers in long-term care settings. After the past few weeks, we sped up vaccine across all the settings. Right now, we're vaccinating nearly 27,000 people on an average day. Since opening January 26th, our state-led mass vaccination sites have given out more than 30,000 doses of COVID-19 vaccine. I'm proud of the hard work of our team, our providers, and the public. Everybody's doing their part. And so now I want to address one of the most common questions you've been asking. Am I guaranteed a second dose? We know there has been a little confusion around second doses. Second doses should be administered like this. For the Pfizer vaccine, the second dose should be given 3 weeks or 21 days after the first dose. For the Moderna vaccine, the second dose should be given 1 month or 28 days after the first dose. We're committed to ensuring there is a second dose of COVID-19 vaccine for everyone who receives their first dose. We have asked our providers to prioritize vaccine series completion. This might mean using first dose supplies to vaccinate people who need second doses. To stay on track, providers should schedule second dose appointments when giving that first dose. People should make sure they're getting their second dose at the same place they got their first. Please remember to bring your record card back with you. It's important you receive the same vaccine each time. There is a process we'll be facing together over the coming weeks, so please be flexible as we navigate the waters. Together, we'll make sure people get the doses they need. Now I want to talk a little bit about vaccine supply. We wish we could give everyone vaccines right now. In fact, my parents are still waiting to get their vaccines here in Washington state. But supply from the federal government continues to be our biggest challenge. This week, our providers requested more than 440,000 doses of COVID-19 vaccine. That's first and second dose requests. In all, we received just over 200,000 doses, which is less than half of what our providers asked for. Although doses are not where we would like them to be right now, we are optimistic about the future. The federal government tells us that allocations for both Pfizer and Moderna vaccines will increase in the coming weeks and months. And the progress of the Johnson & Johnson vaccine is also encouraging. Last Thursday, Johnson & Johnson announced they submitted an application to the FDA for emergency use authorization, also known as an EUA. The FDA could decide by the end of this month. And if the J&J vaccine can meet the FDA emergency use authorization, that means we would have a third vaccine to use in March. And on the allocation forecast, here's some more good news. For the first time, we've received a 3-week allocation forecast from the federal government. Up until last week, we only got that notice 1 week at a time, which made planning incredibly hard. This will help us develop a multi-week strategy to help with consistency and predictability, which will help for both the providers on the ground and all of the public who are looking for places to be vaccinated. We hope to have this plan fully in place in the coming weeks. And before wrapping up, I want to talk about the winter weather heading our way. If the forecast is correct, we may see significant snowfall in our area as soon as tomorrow, and it may stay snowy throughout the weekend. Please do not put yourself and others in danger by driving in the snow and ice to get your COVID-19 vaccine. If the weather is bad, we may have to close some sites and reschedule appointments. Please remember, your health and safety is our #1 priority. I want to end by thanking the public for your patience. We know many of you want a vaccine and waiting is not easy, but we promise your turn is coming. Thank you.
All right, thank you, Assistant Secretary Roberts. This brings us to the Q&A segment of today's briefing. We have several reporters with questions today. If we're not able to get to your question, as always, please reach out to us at doh-pio@doh.wa.gov. Our first question comes from Ariel with the spokesman.
Great, thank you. The Biden administration announced a couple weeks ago that they would be sending more vaccine doses directly to pharmacies in the coming weeks. I'm wondering if the Department of Health is aware of how this will affect our supplies and if the department has the ability to tell the federal government where to send those doses.
Ariel, thank you. Michelle, I'll say, because I just saw Ariel this past week in Spokane, so great to hear your voice. And Ariel, thanks for that question. As you may have heard with this, this is a new pharmacy program that the federal government has launched. And as you have also heard that the states have, while we have been made aware of the information and what's going to be happening, and we've had some limited amount of input. For the most part, this is a program that the federal government is working through with the chain pharmacy stores. So it brings up a couple of comments. One is that it is a separate allocation of vaccine doses. It is not taking away from our vaccine doses and the 100 and some thousand that I referred to at the beginning. But at the same time, it also underscores the point that we want to continue to advocate, which we have been, by the way, with our federal partners, that the states really should have involvement that's going to help us define where those pharmacies are within states so we can really assure that they are equitably accessed or available throughout communities across the state of Washington. So that's in general what we're doing behind the scenes. Michelle, if you wanted to add some additional specifics to this program, because I know you've been in touch with the federal partners about this program in specific.
Yeah, I can just add a couple more points. So we just found out yesterday that the facilities that are participating in Washington right now for the federal program got 22,500 doses of vaccine. And again, like Dr. Shaw said, that vaccine is a separate allocation from our state allocation. That vaccine went to 202 locations to 3 different pharmacy groups in our state: Safeway Albertsons, Costco, and Health Mart independent pharmacies. So we did have a role in helping the federal government decide which pharmacy chains to start with. And so we helped pick the Safeway, Albertsons, Costco, and Health Mart. And that is the initial rollout. And then if you've looked at the information on the federal website, there's many other pharmacy groups that will be eligible to get vaccine through the federal program as vaccine supplies increase.
All right, thank you. Our next question comes from Kelly with KATU. Go ahead, Kelly.
Hi there. Hopefully you guys can hear me. My question is also about the vaccine rollout with pharmacies and the federal numbers that they're getting. I know you just told us how many they got. How do you think that this will help in Washington State roll out vaccine even more? And do you expect other pharmacies, some notable major ones are like Walgreens and CVS, do you expect them to be signing on as well?
Yeah, great question. I do expect all the pharmacy chains who are eligible to participate in the federal program will participate. Like I said, it was the federal government limited the amount that are starting off in this initial start of the program just based on supply. So I think it's another way to increase access across our state. We know pharmacies that do have vaccine either from the federal program or they're getting vaccine from the state program are doing a great job in meeting the 95% requirement and using up all the vaccine they get in the 7-day period. And we have really great reporting for pharmacies. So they're doing a good job. And it's really important that it could be another spot for community access. So maybe in an underserved community, or maybe just when anybody is out getting their grocery shopping, they can schedule their COVID vaccine appointment at the same time. So we think pharmacies are one of the types of providers that need to be part of the mix, along with the healthcare system, employer-based clinics, mass vaccination, community pop-up clinics, and mobile vaccination clinics. So they're one of the important locations where vaccine needs to be to ensure communities have access.
All right, our next question comes from Simone with Q13.
Hi, thank you so much. I'm wondering what you would attribute to the huge disparity between how many Hispanics especially have been vaccinated versus the percentage of population, and also just how disproportionately impacted they are by the virus as a whole. So why is it that their percentages are so much lower than other groups, especially given the impact of COVID on this community? And in addition to that, why are we just now hearing about this data that's going to be released later today and a highlight on this issue? I think that throughout the pandemic, we knew that these communities are disproportionately impacted. So why are we hearing about this now in the middle of February? Thank you.
Yeah, thank you. Thanks so much for that question. You know, as you remember, I'm also coming, my previous position was coming from a community that had a large Hispanic population. And I will tell you, as I've been speaking with, and I know our Department of Health colleagues, my staff members that are here are speaking with their colleagues across the country. This is, unfortunately, this is happening throughout the United States. And there have been a lot of reasons that have been offered, not just for vaccines, but even for a number of things, right? Why do we have less testing in certain communities? Why do we have less communications in certain communities? Why is there more mistrust in certain communities? And I think the answer is really a very complex group of a number of answers. And so, yes, when we're talking about our Hispanic community, we know that there are linguistic issues, language issues. There may be issues around immigration. There may be issues about trust and mistrust with sometimes with government or public sector. We also recognize that there may be a hesitation for the vaccines themselves. And We're hearing also that there is some information that's going out through various social media outlets that is providing information for certain populations to wait, to hesitate before they actually get vaccinated. So it's really hard to pinpoint exactly where we have some of these, what are the reasons. But I do want to say a couple of things. One is in terms of releasing this information now, we wanted to have enough information, enough a real look at what was happening in the vaccine efforts. And I think you could even make a cogent argument that right now, as we are starting with the 1A population, which was, as you know, healthcare workers and first responders, which unfortunately is also from a race ethnicity standpoint, a population that may be less diverse. Again, it doesn't excuse, but it does potentially explain why you may have some differences in race ethnicity data across different groups. But in addition to that, it's also looking ahead that as we are now vaccinating in other populations by age and also eventually by sectors, by occupations, that we are going to need to continue our work in this area. So your question about why now, and frankly, we could also be waiting to get some more information about the 1B1 population before we release. But we felt it was important to get this information out, not just preliminary information, but also the information that we have right now. Now, we know that we're going to continue to add to this information. We also recognize that it does have limitations, right? So some of the limitations very much are that we have, which I did not mention, but we have about 11% of the vaccine data that do not indicate race ethnicity. So we have some questions, and so we have to keep across the country. Folks with disease is something that people have to do with a cautionary look. But again, we felt it was very important to get this information out. Now, I always think it's about the what, but it's really about the now what. It's what do we do with this information? And I think that it's a combination of really continuing the efforts that we have had in place. I want to make sure it's clear that this is not just starting today. We have been working on this for months on how to address these kinds of things when it comes to race, ethnicity, or inequities, even by urban areas, rural areas, geographic areas, smaller jurisdiction, larger jurisdictions. We want to take a markedly more diverse lens or set of lenses as we look at equity information across the spectrum. I think this might be a good time, Simone, as you asked that question, for me to invite Paj Anandi to make some comments. I think Paj can really describe really some of the strategies that we're looking at with equitable vaccine distribution and why it's so critical that we all work together. Because again, sometimes we are champions of messages, but we have to rely on those trusted messengers within communities so we can get really more equitable vaccine distribution in those communities. Paj?
Thank you, Dr. Shah. Good afternoon, everyone. For those of you I haven't met before, my name is Paj Nandi, and I serve as the Director of Community Relations and Equity. And as Dr. Shah indicated, I think there are a lot of factors that are contributing to the initial inequities that we're seeing in our data related to vaccine. And I will also add that in addition to some of the systemic inequities, including racism that is baked into the structures of government, we're also looking at factors such as low supply and also looking at vaccine hesitancy. I think Dr. Shah mentioned that. We know from even our community engagement efforts that BIPOC communities and other historically marginalized groups have a lot of hesitancy and have a lot of distrust for very valid reasons. And at the same time, we also know that we have solutions by working with community to actually address some of that vaccine hesitancy. So I want to quickly just kind of go over some of the strategies that we've been identifying. There is no one single strategy that's going to turn the course around inequities. These are long-standing inequities, and our systems are basically designed to perpetuate the same status quo. So it does take a lot of resource and a lot of work to sort of work against that. And we've been actively working to really change that status quo to the best of our ability. I want to start out by saying that one of our key strategies has always been to engage communities to inform vaccine prioritization and planning. And a strong example of that is we heard from BIPOC communities directly that they shared the need to prioritize older adults and elders who are cared for at their own home. And this kind of feedback directly informed the inclusion of older adults in multi-generational homes in phase 1B, tier 1. We know that we need to continue to solicit community feedback as we look at titrating the other phases that are coming online soon, and also solicit community feedback for phases 2 and 4, which again are still to be determined. We also need to integrate a more pro-equity approach in the way we allocate vaccine and distribute vaccine. There are so many access barriers that we've been hearing about from community leaders and partners over and over again, including language access, technology access barriers, transportation barriers, et cetera. And we know that even within our MaxVax sites, we can integrate an equity lens, for example, by starting to reserve appointments for phone-based scheduling. I know we've been doing that in Clark County. I believe 20% of all appointments are now going to be phone-based. We also want to prioritize allocation to providers who effectively serve disproportionately impacted communities. And we have tools that we've designed, the COVID-19 Social Vulnerability Index mapping tool, which is unique to Washington State, borrowed from CDC, that can help align vaccine allocation and coverage, especially in areas with high social vulnerability. We want to continue to invest in and actually increase our investment in trusted community messengers and organizations. I think I shared that at the last report out that we have contracted and subcontracted with community-rooted, community-led organizations, and they are the ones that are best suited to support community-led vaccine outreach, especially for those that have been disproportionately impacted. A great example is that we have one of our contractors right now, Black Lens in Spokane, who is organizing a radio show to address vaccine hesitancy with the Black community by incorporating trusted leaders from that community. We also want to ensure that all our communications, education, outreach efforts are culturally and linguistically appropriate and accessible. So we want to make sure that it's a multi-modal strategy, that all information is available in our top 36 languages per our language access plan, that we leverage community-based social media influencers. We look at community-driven, culturally appropriate messaging, and that we also do in-language audience testing for any campaign messaging that's going out, because that is going to be really critical in addressing some of those hesitancy, and not really also ascribing a monolithic approach to communities, knowing that when we say the Latinx community, there is a lot of diversity within the Latinx community. And how do we truly honor and respect that diversity and really seek input from community members that really are part of that diaspora? And then some of the other strategies I'll quickly mention are strengthening the public health system and their ability to center communities in vaccine outreach and access. This is really happening at the local level, and our local health departments are working very hard along with vaccination partners to really expand vaccination access. As Michelle Roberts mentioned earlier, we just don't have enough supply, but as supply increases, how do we create structures and systems that allow community-based sites to be more accessible and available? So we've been working internally to create community-specific outreach and engagement plans. We plan to share them with our vaccine implementation collaborative partners next week as well, and just continue that ongoing dialogue to see what is really working for the state of Washington and how can we better inform our efforts so that they are trauma-informed, they are community-driven, community-led, and so that we can truly honor community who are closest to the solutions than just relying on state planning and sort of best faith effort. So I'll pause there.
All right, thank you. Our next question comes from Keith at Como.
Hi, thanks for taking the questions. Are you hopeful that with the improving numbers that the regions, more regions are going to be able to move to phase 2? You announced it on Friday. And are we seeing a decline in cases because we're also seeing a decline in testing? Is there a cause and effect relationship there? And are you worried about a possible fourth wave with the variants?
Yeah, thanks for that question. And in fact, this is a number of the questions I was receiving on the ground this week from partners in the communities that I visited. This was a really important set of questions for them, which was about the roadmap to recovery. Where are regions and how do we move forward? What are the numbers and what are we seeing? And I want to invite Dr. Lindquist in on this as well. Let me just make a couple of quick comments, and then Scott can provide some additional details. The real reason that all of us are so focused on vaccines and vaccinations is because it is a race against time, and we are concerned about a number of factors. One, we're concerned about COVID fatigue and people saying, "Look, I've been doing this for a year, and I'm just tired of wearing a mask or all the 3 W's. We're also concerned, as we're seeing on the ground, that people, as they're focusing on vaccines, they are also thinking that they do not need to get tested. And in fact, just yesterday in Spokane, while there was the mass vaccination set up, there was also testing that was happening at the Spokane Arena. I had an opportunity to talk to a few people, and one of the younger people that I spoke with, a younger woman who said that she was very much concerned that she, may have been exposed, and she wanted to make sure that she got tested. But she also indicated in that same breath that there are others in her age group that are dismissive of that. They don't think that they need to get tested. And then the others are confused because they think that vaccinations means that you do not need to wear your mask, watch your distance, wash your hands, and certainly that you do not need to get tested. And so we have to really fight this misinformation. It's absolutely critical. And then certainly that feeds into leads into both the concern for increases in cases, right? Post Super Bowl, where we are concerned in public health across the country that 2-3 weeks later, we're going to see an increase. We're also concerned about the fact that we have variants now in the United States, and we have to really be mindful of what that's going to look like. And that really leads to your question about the fourth wave. We're still in the midst of trying to get off this third wave here, and our goal is to really come down from this in a way that not just drives these numbers down, but drives them significantly down, so we can all be assured that while we continue our efforts to vaccinate, that we are also approaching the best lens that we can for avoiding a fourth surge. There are a lot of discussions happening across the country whether we are going to see one, but right now it's just speculation at this point. Scott, did you want to add a few things to this?
Yeah, I just wanted to add that it's a great question. We are seeing a decrease in our case counts. We're seeing a decrease in our percent positivity, decrease in our hospitalizations, and a decrease in the percentage in our intensive care units. So altogether, those are trends that are hard to ignore. None of us have seen the generations of the data for this week. That'll be done and presented on Friday. So we hope there will be some improvement where other counties or regions are moving to phase 2. There is some decrease in the amount of testing being done, but given with those other 4 indicators I talked to earlier, we are seeing improvement, and that is the hope. Just a reminder about the variants. We are really ramping up our ability to do surveillance on the isolates. So once we get a positive test and then we genotype those, the goal is to be doing about 5%. We are one of the states that is doing a very high level of genotyping to look for these variants. And following those variants to see what percentage of isolates are actually variants of interest, compared with the data that I just talked about, that's going to give us our best sense of whether we're going to have a fourth wave. But as Dr. Shaw said earlier, we are coming down the backside of the third wave right now. And we hand that back to you, Frangie.
All right, thank you. Our next question comes from Sandy with the Seattle Times.
Thank you so much. For Michelle Roberts, you mentioned that you've asked vaccine providers in some cases to use first doses for second doses. How prevalent has that been, and what kind of impacts are you seeing from that?
I think there we go. Now I'm unmuted. We're trying to correct what we think was some confusion several weeks ago when we rolled out the 95% requirement around how would that apply to the second dose. And we did see some providers, and it just is hard at the provider level to manage, multiple pots of inventory, but where first doses were used for second doses. Second doses were used for first doses several weeks ago. And so that's created quite a demand right now on making sure we have enough second doses to meet those first doses that were given several weeks ago. We're working to figure that out. You'll see, I think we put some information out last night on social media that was really showing that we have an incredible amount of requests for doses this coming week. Around 180,000, and that's almost our entire allocation. So we're working to understand the scope of the problem and then identify a couple different options about how we can how we can manage that. These first and second doses line back up for the future. So that will make sure providers are asking for the vaccine they need over the next seven days for the right amount of second doses appointments that they have scheduled, and then ensuring that the rest of the vaccine is then for first doses. So we're still working on kind of the whole scope of the problem, but working directly with providers to ensure that they are scheduling second dose appointments when they're making first dose, because that's going to allow them to, or help them give us accurate information on how many second dose appointments do they have each week. And then making a plan for how can we kind of realign where the first and second dose needs and get that taken care of, so that going forward we could be back to how much vaccine first and second doses can be used in a 7-day period.
All right, thank you. Our next question comes from Sam with KEPR.
Hi, thanks so much for taking my question. My first one is just to Dr. Shaw. I know he visited the Benton County Fairgrounds yesterday in Kennewick, and I just wanted to see what his initial thoughts about the operations down there were. And then also, I know we've talked a lot about there's more demand for the vaccine than currently available, and right now the discussion with vaccine equity, but is there any more information kind of about delivery for second dose vaccine at the mass vaccination sites with those deadlines coming up pretty quick for some of the people?
Yeah, let me, I'll give my impressions in just a moment. Michelle or Lacey, did you want to address that second dose question about the vaccination sites? And then I'll come back.
Yeah, we are, many of the, well, actually all of our mass vac sites will be transitioning to offering some second dose appointments next week. Actually, I should say maybe with the exception of the Spokane site, who's the one using Moderna vaccine, who would still have another week out. The other three sites have people who are ready for their second doses, and those appointments have been scheduled, and we will be doing both first and second dose appointments at the mass vac sites next week.
Lacey, was there anything you wanted to add? Okay, not hearing. Yeah, so thanks for that question. I really was impressed by the operation. I met Chief Greer, I believe, who was the incident commander on the ground. He was working. He's part of the, I believe, Kennewick Fire, and he's been through so many different emergencies. Very experienced in the work that he does. I met our Department of Health staff, who were just doing a fantastic job of overseeing the operations and integrating in with what was happening, alongside with our National Guard or State Guard folks that were there. I'll tell you that I was very impressed by how quickly they were processing people through it. It really is an amazing operation when you see the number of lanes that are put in place. And I've now had a chance to visit 3 of the sites, and all 3 of those sites are very different. When you go down to the one in Clark County that we have, it is inside a big arena, if you will, and you drive through and you kind of come in and your car comes in, and then people come almost like a pit stop at a race, where they come out and then they vaccinate you, and then you pull back out and you're on your way. Whereas going to Spokane was people coming into an indoor arena, and they were saying that from beginning to end, it was a 6-minute process before they get to the 15 or 30-minute wait period area after the vaccination. So very, very efficient operation. And then at Kennewick, it's a drive-through where you drive through, and there are multiple lanes that are open up, and the vaccinators, who included the paramedics as well as the State Guard, they were just fantastic. And like I said, they let me give one vaccine myself, and I'll be honest, it took me just a moment to get my gloves on. It's been a while since I've given a vaccine. Licensed to do it and able to do it, absolutely. But it's been a while since I've done that, and I just wanted to really recognize the incredible team efforts that were put in place. What I did make sure that I made known to the entire team, though, was the importance not just of numbers and people, but that we needed to make sure that it felt welcoming and safe for all community members. As we just talked about race, ethnicity data, also those who may be mobility issues or challenges that might be in place. We wanted to make sure, or I wanted to make sure, that I was bringing that message to them, that it was also not just about throughput, but it was about assuring equity. And the good news is they were already thinking about better outreach efforts with the local health department. So the Benton County Health Department, I had a chance to visit with them as well, and they were also at the site, and they were talking about the outreach efforts to get people into the mass vaccination or high throughput clinic. So I was really impressed by the operation. I know the biggest limitation we have right now is supply. And that's true for those sites as well as elsewhere across the state. 358,000 vaccine requests and for first doses, and you have 110,000 to go around. The math doesn't work in our favor, but we know that the governor had requested us to build the capacity. So once the vaccines were there, we could, in a modular way, increase the numbers, and we've got to do that, but we also have to do that in an equitable way. So again, overall, impressive operation. I can't wait to go back.
Thank you. Our next question comes from Jefferson with NCW Life.